Welcome to COVID and Guns, a video series brought to you by the Center for Firearms Law at Duke University School of Law. In this series, we talk to experts on various aspects of firearm law and policy about the role of guns in the ongoing pandemic. I'm Jake Charles, Executive Director for the Center, and today I'm joined by two distinguished guests, Dr. Jack Rozel, Associate Professor of Psychiatry and Adjunct Professor of Law at the University of Pittsburgh, and Dr. Layla Soliman, Associate Professor of Psychiatry at Atrium Health. You may know them from Twitter, where they tweet at @ViolenceWonks. Thanks to both of you for joining us today.
Thank you for having us on.
Of course. So first off, can you just tell us a little bit about your methodological approach to studying firearms? What perspective are you all coming from?
And what Jack and I pride ourselves on is taking a perspective that's clinical, something that's going to help you know what to do with the patient that you have in your office at 4 p.m. or in my case on your inpatient unit when you're safety planning. And so we take an evidence-based approach toward risk factors and evidence behind whether a home is safer, less safe with a firearm, and who's really at risk. But we also take an approach that is balanced. We're from different ends of the political spectrum, or at least different sides. I don't know that either one of us is really on one end or the other. So we balance each other out that way, but we also try to just be purely evidence-based about it, so that we can come up with evidence-based recommendations to help our patients have better outcomes and to mitigate their risk.
Yeah, I mean, it came from some conversations we'd have. When I was in med school, my training about firearm injury prevention was, go in there, ask them if they have a gun, and if they have a gun, tell them to get rid of the gun. And if you do that, like arched eyebrow, judgy doctor thing, even better. And it's not a very effective strategy to work with families and patients who are gun owners. And Lila and I, we'd be on the phone like, how do we do this? How do we do it better? And we started digging through the research and the literature and have really tried to say, what does the science really say? And the other part of this is whenever something really bad happens, there's some pundit out there pointing at psychiatry and saying, you should have fixed this, you should have prevented this. And we know what the science says. We're forensic psychiatrists. This is sort of our bread and butter type of stuff. And we know the limitations of that, but we also know where it does need to be applied. And so we've tried to bring that taste and that flavor to the work we do.
Yeah. So speaking of evidence, there's been some reporting about increasing gun sales, motivated at least in part as a result of COVID. And I'm just wondering if you two have thoughts on what might be driving people to be purchasing guns at a time like this.
Probably not because they think they can hit a virus with a really good scope on the gun, right? People are buying the guns. Again, we don't know. We're in the midst of this. We don't have exit polling from the gun shops, but we can make some interpretations with it. Fear is probably part of it. The question is fear of what? Fear of social decay, probably more so than fear of restrictions on gun sales, although that may be part of it with, shifts in different states and whether or not they're letting the gun stores be open. But we know the last time we had a big surge of firearm sales in the wake of Newtown, Connecticut, that was mostly driven by fear of restrictions. And I know Lila has a slightly different take on that. But yeah, so we've got a bunch of folks who anxiously went out and impulsively bought guns. Anecdotally, what we've heard is a lot of these are new gun owners or not very experienced gun owners. And wherever you stand on gun control, Second Amendment rights, anxious, impulsive, and untrained is not a great combination for a gun owner. To use a gun safely, you got to have good instruction, good training, and it's hard to do that without someone at your shoulder at the range.
I'd like to add, I do have a slightly different perspective, but it's more of a yes and than a yes but. I think another reason is, take Newtown and take what's happening now. It's horrible and it's horrifying and it's heartbreaking and people feel powerless. In this case, we can't see the enemy. And in the case of Newtown, none of us really fathomed that there would be a shooting in an elementary school with these tiny kids. And I think that people wanted some way to feel like they could keep themselves and their families safe. And human beings crave some sort of control over their environment. And I think a lot of people envision themselves being the proverbial good guy with a gun, who can protect their family in the event of a societal collapse, and they can protect themselves and their family in terms of both resources and physical safety. And I'm not saying that you can't have a good guy with a gun. You can, as long as that person is well trained, has good situational awareness, and doesn't panic. And that's something that takes a lot of practice. You can't just buy a gun, put it aside, not shoot it for years, and then when something happens, think that you're going to be able to manage this effectively.
Yeah, and so some of the motivations that I hear you all talking about, I wonder your perspective on whether or not you think any of those or any of the other conditions caused by this particular time, maybe social isolation or despair or economic insecurity, any of the other risk factors for violence, either self-harm or violence against others, do you think guns are posing a particular risk during this time?
Jack, you want to?
Yeah. So again, let's go way back in time to right after Newtown. And the year afterwards, there's some great research by Levine and McKnight. Because of that surge of firearm sales right after Newtown, for the 20 children and 7 adults killed mercilessly at Newtown, 40 adults and 20 more children died accidentally of firearm injuries than we would have expected. This was published in Science, so I think we'll agree that's a reputable peer-reviewed journal. There was some additional great research that looked at homicides. Firearm homicides went up significantly, most in the states that had the biggest surge in gun sales, and mitigated to some degree in the states that had waiting periods on purchases. And that was after Newtown, when it was normal operations, if you will. We weren't isolating at home. We weren't worried about our employment. We weren't having our kids running around the house bored and stir crazy because they haven't been able to get out. We weren't worried about our health insurance. We weren't sitting in the laps of, what were loving families, but, boy, that starts to go a little bit sideways after 6 to 8 weeks. We didn't have all these other stressors going on. So we don't know yet. It's too early to know, but we have concerns. Reassuringly, in 1918, with the Spanish flu, suicides actually went down for a couple of years during that event. Bad news, as soon as the flu cleared, they went right back up again. Mm-hmm. So yeah, there's some new risk factors, and it raises a lot of concerns. And we also know, what's interesting from the TSA, is saying that they've seen a surge in the number of people showing up with firearms with them at the airport. And it's a small subset of the travelers, but it's almost tripled compared to their baseline, which again says people are anxious. They've got the guns with them. And going back to Lila's point about you got to be competent to use a gun defensively, if your threat surface is so high that you've got to carry a firearm, you should have the situational awareness to know that you are in an airport. Okay, it's just...
So let me ask one question then, based on the first physicians that we've had in our interview series, and I'm interested in your thoughts on how you approach these sometimes delicate, sometimes difficult conversations that you have with patients or with family members about firearm safety. What kind of pushback you get, how you make it feel like you were saying at the beginning, Jack, not like just a judgmental opinion coming from a doctor about having firearms in the house. How you guys approach those conversations?
I personally approach them by being as relatable as I can. So I'm very honest with them that I'm not anti-gun. I've fired guns, but I am in the business of trying to help them live safer. And if they're seeing me, they're in the midst of a crisis. They're on an inpatient unit. There's no not serious reason to be there or not severe reason to be there. And so I talked to them about how big this really was and how we know that it only takes a split second to make an irreversible choice when things seem hopeless. And most of the time that works. I've had a couple of people where their family members were the gun owners and they refused to give them up. So I talked to them about safer storage. I I can't think of a situation where somebody has not at least been willing to make some necessary modifications to how they're stored. The tougher cases are when people really don't think that they needed to be in the hospital to begin with. But even with them, you know, I think if you come, people can sense when you're being authentic. And I think if you come from an authentic place of genuine concern, most of the time, 97, 98% of the time, you're going to have decent success.
Yeah, humility, compassion, short-term changes. We're not saying give up the guns forever. We're saying right here, right now, while you're in crisis, let's do something to make sure things are a little bit safer for you and for your loved ones.
Yeah. I mean, that makes a lot of sense, and it is hopefully the way that a lot of us are approaching difficult conversations, not with patients, but you know, with other people that we're having difficult political conversations with. Authenticity, humility, and you know, being open to another viewpoint, another side. Well, thank you so much for being here. Really appreciate giving your perspective. I had a lot of fun and learned a lot, and we really appreciate your time. For those of you at home, thank you for joining us for this conversation. Please follow along on Twitter, both us and Violence Wonks, and visit our website at firearmslaw.duke.edu. Thanks very much.
Thank you.